Welcome back. If sleep feels more elusive as you age, you're not alone. 1 in 3 Canadians don't get enough sleep. 55% of women and 43% of men have trouble falling asleep or staying asleep. And nearly half of us don't find our sleep refreshing. Lack of sleep can lead to obesity, type 2 diabetes, cardiovascular disease, injuries, depression, irritability, and reduced well-being. We've been talking about all of that. So what can we do about it?
Well, I think there's 2 major things you can think about. One is whether or not you have chronic insomnia, because you did mention difficulty falling asleep or staying asleep, which is a really common one. You can take medications, but the frontline treatment for chronic insomnia is actually behavioral. Cognitive behavioral therapy is a type of therapy. It's very brief. It's like 2 to 4 sessions in which you try to leverage some of what we know about your sleep system and make some changes so that you're able to fall asleep. It's really things like waiting until you're sleepy, actually actively falling asleep before you go to bed, rather than necessarily having a bedtime, that you have a wind down before you go to bed, that you get up out of bed if you are unable to sleep and you don't go back until you're sleepy. You have a regular rise time. And it's a lot of the things that we do with kids, that sort of make sure you have enough activity during the day, that you have daylight during the day, that you have a wind down and a routine. These are some of the things that we actually have to do. And what we find is that as people age, they typically become less active, and they might stick to some of their older routines that don't suit them any longer. Plus, there's a greater probability that you have a medical condition or you're on a medication that might interfere with sleep. So I think some of those things, and talking to your doctor if you do have a sleep problem or seeking out cognitive behavior therapy, is really important. And the last thing I'll say is if you're falling asleep during the day, that's a sign that you should talk to your doctor as well, because sleepiness is a problem and a sign that something is wrong. And obstructive sleep apnea is one of the most common things that you're going to see over the age of 50 that you should get checked out.
I've seen all this stuff about sleep hygiene, turn off all your devices, don't eat several hours before. Is that what you tell your patients to do?
Yes. Is it what I do or what I tell my
No, what you tell your patients.
Yes, that is what I tell my patients to do. Absolutely. So, those things can make a very big difference for people who are having trouble. So, and I really have noticed that the consistent wake up time thing, and especially getting some outdoor light, some ambient light in the morning, is one of the things that can make the biggest difference for people. I think as you age, maybe you don't have to be somewhere at 9 a.m.
Exactly.
You're not working, you do have a little bit more leeway when you're binge watching TV and, with that extra cup of coffee or tea or your alcohol. And so I think that's also part of it, is really sort of reining it in and saying, okay, we do need to be a little bit more judicious about sort of the behaviors that we're doing during the day to set us up for something good later on.
May I jump in for a second?
Sure.
I have some good news. So we have used the term sleep hygiene on the internet way too broadly. And I'll tell you that sleep hygiene, when I do a clinical trial, is my sham treatment. It does not work. So it's really important that we say that. But what you're saying—
Turn on the computer.
What you are saying in terms of the behaviors, like a regular rise time and some of these other behaviors, is absolutely true. But that's not actually what sleep hygiene is. So sleep hygiene is a treatment about reducing alcohol, weed, caffeine, and making sure your room is dark. And so it's basically about the environment and about substances. Those are fine, but that's not going to get rid of chronic insomnia, because that's not the cause. So it's really important that if you have chronic insomnia, that if you see sleep hygiene on the internet, that's not really what you should be running towards. You should be running towards these, as you say, these things about like setting a regular rise time and working on some of those behaviors. But feeling like you have to cut out any caffeine. Most people that come to see me are the worst of the worst, and they have not been on caffeine for years, poor things, and it hasn't worked. And it's not fair that we do that. So in fact, the American Academy came out last year, and we said that we advocate that you do not use sleep hygiene. In fact, because it's caused a lot of problems, and it's just too broad of a term.
How do people know when this is kind of a garden variety problem versus a serious problem?
Certainly the chronicity. So if it's happening on half the nights of the week and it's been going on for several months, 3 months or more, and it's causing daytime problems as well, then the bar is actually really low for insomnia disorder. And we do that on purpose because it's so common and people just assume it's part of aging. And
That's true.
And it's not. It's something, part of healthy aging can be healthy sleep as well. So I think it's really important that if you have a chronic insomnia problem, that you seek help. Because cognitive behavior therapy is available for free at TMU. It is available in books, online. You don't have to see a therapist if you don't want to. So there are different ways to access it, and I think for a lot of time people have thought, well, I can't access it. But that's, in the last 10 years, we've done a lot to make sure that it's available as freely as possible.
Okay, stick around. There's more when we return.